Hi, I'm Joanne Conroy, President and CEO of Dartmouth-Hitchcock and Dartmouth-Hitchcock Health. Thank you for joining us for our Facebook Live with Dr. Steve Chapman, Take 3. Again, apologize for some of our audio issues, but hopefully we've got this solved now. So Steve, what a timely topic. We talked about doing this over a month ago, but it was on the front page of the newspaper today and is really a top story in a lot of the local news.
Yes.
Before we actually get into the big question about kids going back to school, you were involved in a number of other organizations, the New Hampshire chapter of the American Academy of Pediatrics. You have just completed a leadership term there. Talk a little bit about the role that organization plays in statewide policy that affects kids.
Sure. So the New Hampshire chapter of the American Academy of Pediatrics has as its mission advocacy on behalf of kids and families and the promotion of strong and healthy systems of health care for kids. The National American Academy of Pediatrics does the same. And of course, over the last spring and through till now, the effect of COVID on daycares, on schools, on the health and development of kids has been first and foremost. And so we've been very active in the state and nationally in looking at those systems of care. I should say Eric Schessler is the current president of the New Hampshire chapter of the American Academy of Pediatrics. My term ended 2 weeks ago, but I'm still on the executive committee, so still very involved.
Yeah, good talent is hard to find. They'll keep dragging you back into responsible roles there. So talk a little bit about the American Academy of Pediatrics, because I'm sure they've kind of been under pressure to give advice about school opening. And I can tell you it's a hot topic on every single channel.
Yes. So we know a lot more about the virus today than we did 3 months ago, and we'll know a lot more a couple months from now. So whatever schools and communities do really needs to be nimble and flexible and responsive to the current reality. But we've been advocating for the physical reopening of schools really wherever possible. The guiding principles, though, have to be kindness, community, and data. We need to pay attention to what the data is telling us about regional outbreaks and regional prevalence of COVID, and also the extent to which the virus affects children, both in terms of how often they catch the virus, how often they get sick from when exposed to the virus, and really how likely they are to spread it to other children and to adults.
You had some interesting data about the YMCAs across the country. I think our audience would really appreciate hearing that.
Sure. So, there's a lot of nervousness and a lot of worry, and of course, all of us who are parents, there's nothing more important than our kids, and so we want to be sure that kids are safe. So I was looking at some data from the YMCAs that conducted daycares, that held daycares for children of essential workers, really from the very beginning. And they looked at about 40,000 kids in over 1,000 settings. And the transmission and the likelihood of catching COVID was extraordinarily low. There really were no outbreaks that shut down any of those daycares. And the incidence was very low. Of the kids, it was 0.16% of kids in those daycares developed an infection. And the rate of infection of child care providers was less than in the surrounding community. So the current data and what we know is that daycares with proper precautions, with masks, with staying home if you're sick, if you have a fever, are really safe places to be. Really safe places to be for if you're a child, really safe place to be even if you are there with a child of a healthcare worker.
Let's talk a little bit about how COVID-19 affects children, because it affects them very differently than it does adults. And maybe talk a little bit about, are there different signs and symptoms as well? When we come into the hospital every day, we're screened for our temperature, and we have a whole list of symptoms they ask us about. But my expectation is that list would be different for kids.
Yes, well, this is a funny virus. We're used to most viruses really affecting kids as much, if not more, than adults, and it's really the opposite. Kids seem to not catch the virus at the same rate as older adults. They seem to not get as sick when they do get the virus. And they seem to be not really as efficient, which is good, at spreading the virus to other kids and to adults. The symptoms that kids get can be cough, can be fever, can be some stomach upset. You know, sometimes it presents that way. But you know, honestly, we've been very fortunate in New Hampshire, Vermont, and Maine here in northern New England. You know, we have regionally very low rates of COVID by and large, and among kids. In the state of New Hampshire, only 5% of the positive cases have been in kids under the age of 18.
Oh, wow.
And of those kids who have, in New Hampshire, who have gotten COVID, only 1.5% of those have needed to be hospitalized. So that's a total of 9 kids in the state of New Hampshire from the very beginning. All 9 of those have done relatively well, did not stay in the hospital for very long, and are doing fine at home. And so the experience that kids have with the virus is really unlike almost any other virus that we see. It's not like the flu. It's not like many of the other respiratory viruses.
Earlier in our experience with COVID-19, they talked about rashes on children. Is that not really played out as a sign or a symptom?
Well, it can be, but it's not a cardinal sign. It's not, a rash in a child is not something where we would think COVID. It is something that can be seen, but I'm not sure I would ask people to look for a rash, and if you see a rash, think COVID.
Yeah. There are probably many other things in the summer, like poison ivy and
for sure.
And prickly
Sunburn.
Sunburn, yes, that can do that. I do want to remind all of our viewers that if you have questions, just put them in the Facebook feed, and they'll be fed to us, and we'll try to answer them in the course of our conversation. If we don't get to them, we will certainly try to integrate them into our post-Facebook kind of Q&A process. Now, what do you see as the most important steps for parents and guardians to keep children, families, and schools safe when they go back to school?
Sure. So there are several basics that we know make a difference. We know that staying home when you're sick, if you have a fever, if you have a cough, if you have stomach flu symptoms, you know, that was true before, and it's even more important now. So,
oh my God, I can't think of how many times my parents said, unless you're bleeding, you have to go to school.
So we need to think about that, and we need to think about this. Gosh, I think it's important to think of this, you know, particularly as a parent, to present this as an issue not just that's fear-based and staying safe, and you know, that's a dangerous world out there, but this is how we take care of each other. This is how we're part of a community. This is how we're part of a school community. We respect each other. We try to. I look out for you. You look out for me, and taking temperatures, paying attention to symptoms, staying home is just part of that. So is wearing a mask. It's most important for adults, but it's really important for kids who can to wear a mask. We know that decreases the transmission of particles. We've seen it here in the hospital. The hospital and the clinic is one of the safest places you could be because we wear masks. We try to stay socially distanced. We wash our hands all the time. We use the hand sanitizer, and those are exactly the things that will be important for schools to do, but it's got to be a partnership. So right now, parents can start to think about how do we develop these habits, how do we talk about it with kids. Again, so it's not a scary thing, I'm sending you off into this dangerous place, but this is how we really take care of each other and are good citizens in the school.
Yeah. How about parents protecting kids psychologically?
That's a really good question. And probably the first step is just opening up a conversation.
Yeah.
And checking in an age-appropriate way. How are you doing? How are you feeling? What you think it might be like to go back to school? What do you imagine about getting together with your friends again in that setting? And just hear what kids say and begin to have that conversation. You know, there's going to be a real transition for everybody, for teachers, for parents, but you imagine if you're a second grader, and imagine how much time 6 months is to a child at that stage of development. It's an eternity. And so that idea of transition And that idea of preparation and really getting ready is going to be, it's going to take some love, it's going to take some attention, and it's going to take some listening and support. And that's something that parents and communities, we can all start to do this summer.
You know, when I think about elementary education, it's really a high-touch specialty, and it's hard to imagine what it will be like when a teacher feels like they can't hug a child that may be distressed. Sometimes that's exactly what they need. And how do you do that in a COVID world?
Yes.
We don't have all the answers.
We don't have all the answers, but you're right. You know, kids can't defer their development. You only have one shot at being a 5-year-old. And they're going to develop regardless of where they are. And we think that schools are important, not just for academics, but for social, developmental, for learning how to interact with peers, for being in a group. All those things are just as important. And we'll have to do some of that a little bit distanced, but I think there's a way. I think it is really important that we try to get kids back and schools as safely and as supported as we can.
You know, that probably rolls into our next question, because our viewer says, why is in-person school important at all? Why don't we just go through remote learning? So I think there's a body of evidence that says why school is important.
Yeah, so we know, there are some kids that can do relatively well with remote learning, and I think people do learn differently, and there are some that do well with the online curriculum. But by and large, most kids learn so much better in person. And then there's the developmental support, emotional support. There are services that are provided in schools, physical therapy, speech therapy, counseling that really are very challenging to deliver remotely. There are families that are food insecure that rely on good, reliable meals that are provided in schools. There's physical activity. There's so much more. And there's that sense of community, of being part of a group, not just your peers, but part of a class and part of a school. That's so important to development. So, teachers in schools have really done heroic yeoman's work. I mean, they pivoted on a dime in March and are now working through their school vacations and deserve all the support we can give them and all the resources that they can be given. But in-person school is something I think that when we can, and I think we can in New Hampshire now, move to.
Now, healthcare workers have particular challenges. Actually, a question came up on my kind of breakfast with the president via Zoom with a bunch of our workers yesterday morning. And one of the women pointed out that there was a question because she's a healthcare worker and she could have contact with COVID patients. Would that exclude her child from attending school? And I'm not sure the school really knew how to answer that question. It's probably important for us to answer that.
Yes.
I know that Michael Calderwood went through some data that said basically our hospitals are pretty safe. If you have a mask on as a healthcare worker and your patient has a mask on, there's very little transmission of disease, where if you go to any of the local supermarkets, we do see, depending on your community, some people that are there without masks. So what advice do we give to both our employees who have school-aged children and maybe even school districts that are balancing whether or not healthcare workers' kids present a greater risk?
Sure. So, I mean, I think we've learned, how to be safe in healthcare settings. And, we were talking before we went live, and we have literally thousands of people coming in and out of Dartmouth-Hitchcock every day and wearing masks, doing the hand sanitizing, some social distancing. We really just don't see transmission. We really don't. If I wear a mask and I'm careful, I feel very comfortable that I'm going to be safe, and I feel very comfortable that everyone in this room that we're working with is going to be safe as well. And that goes for our kids as well. So I really think that kids of healthcare workers are at perhaps even the same or maybe even lower risk because we take precautions all day long. So that goes for kids of healthcare workers in elementary schools, high schools, and daycares as well.
As we were doing our first series of contact tracings, it's interesting that we didn't actually trace contacts of COVID positive people. We just went one layer. And I did ask the epidemiologists, was there any benefit? And they said, actually, there wasn't. The benefit really is to do adequate contact tracing of somebody that's had direct, close contact with a COVID-19 patient. So our healthcare workers, really, their contact is protected, and it should be really no risk for that transmission to a child who would then take it to a school.
Sure. Yes. And honestly, it's the unregulated community gatherings. You know, if people were to go to a big party, a gathering where many people are in close contact with each other, you know, those are really the higher risk situations. And you know, I know schools are doing planning right now, and daycares have been all along. But really, those level of precautions, I think, are what will keep us one of the more low prevalence parts of the country.
Yeah. Talk a little bit about what schools will look like. You know, what do you imagine the classroom will look like, the precautions might look like for kids that are attending school?
Yes. So you know, this is being worked out in school districts all across the country, and I know in New Hampshire and Vermont, and I was on a call this morning with some school nurses. Certainly, some home screening will be part of that. You know, really saying and mindfully thinking, gosh, should I go to school today, or should I send my kids to school today? Wearing a mask wherever possible is a precaution that we should take, even though we think that kids don't catch or spread it as efficiently as adults. Masks, we increasingly know make a difference. There may be some adjustments to some group activities, assemblies, concerts.
How about sports?
And there may be some adjustments to sports. We just don't know at this point. We'll need to see how the virus plays out in the fall, what the epidemiology looks like, and what the numbers look like, and really what's possible. You know, I know sports are important. I know theater is really important. And you know, honestly, if I were to guess, I think we'll do some versions of all of those things. But it will be balancing out safety on the one hand, and then the development and activities that we want to offer kids and give them the chance to participate in on the other hand.
Yeah. Now, how about wearing masks and gloves? Do you think it's important for teachers to wear masks and gloves? Does everybody just wear a mask? What's been the conversation?
Well, the basics are the basics. So masks, hand washing, physical distancing, staying home if you're sick. And those are the most important things. And they're probably more important, just as important or more important for the teachers, staff, administrators, adults in the school who are more likely to catch the virus, more likely to spread the virus. You know, you notice I didn't say gloves.
I noticed.
Really, hand washing is really the key. And if you're doing good hand washing, you know, the gloves are probably not necessary.
As an anesthesiologist, they actually had done some studies about how ineffective gloves often were in inexperienced users. When you want to, for example, track how you contaminated your area with somebody's saliva, you have to take them off right away. You have to keep changing your gloves constantly. And yet, when I see people wearing gloves, they're wearing them all day.
Yes.
And it's
can give you a false sense of security. I put
Correct.
my gloves on and I'm fine, and now I don't need to hand sanitize, when that's really the thing we want to do.
Let's talk a little bit about kind of testing or temperature checks before kids go into school. Are people advocating that happen at the school, that happen at home? You know, what's the process that people are really thinking about?
Yeah, I think those are the discussions that school boards and schools are having right now. For sure, this will need to be a community effort, and we shouldn't just rely on one checkpoint, one person, one point in time. So for sure there will be a role for parents and or guardians and students to do a self-assessment, a self-check at home, which you want to do before you get on a bus, before you get in a car with anybody else, really before you leave the home. So that will be invariably important. And then there will need to be precautions at the school to identify, to remind kids and remind guardians of what are the reasons for not entering that door and what are the reasons for saying, hey, gosh, I'm not feeling so well. So I think we need to have, and schools are working on this, multiple layers of safety at different checkpoints along the way.
As a community pediatrician, do you routinely ask parents what type of thermometer they have at home? Because I would bet
Yes.
there are a lot of parents that actually don't have a working thermometer, or they pull out
Oh,
a mercury
yes.
one
Yes.
that's probably 25 years old and should be banned. So
Yes.
what do you advise
Well,
parents?
I think, gosh, I think we might have a mercury thermometer in our house somewhere, a very
They're
old one.
really good, but I don't
Yeah.
think you're supposed to use them anymore.
Yeah, so having a high quality thermometer does make sense. And there are forehead reading thermometers that can work well, but there are some that don't. And so you don't want to get one that costs $4.99. You know, I imagine this will be something that either the state or school districts will be giving some guidance around. It's something you can talk to your pediatrician potentially about. There are some ear thermometers that can work wonderfully well. But if you have a thermometer that on the same person is giving 97 degrees and then half an hour later it's 99.5 and then half an hour later it's 98.1, then that may be something you might want to think about upgrading.
Yeah. Now, there are a lot of questions about co-curricular activities like sports or drama club, which I can only imagine singing or speaking to an audience would not be optimum if you're trying to
Yes.
minimize the spread of
Yeah.
viral particles. Are people thinking about creative ways to create that same experience, but not in person?
Well, you're right. Singing and some activities will require, at the very minimum, a little more social distancing. And so you can imagine a spaced out auditorium with people singing and creating a different acoustic. We saw the cast of Hamilton sing on a Zoom broadcast, and there are performances that have been going on all over the world of people participating remotely and bringing in a unified audio feed. You know, I think it's going to require some creativity and some thought about how do we protect each other while still pursuing those things that move us and that are important to us. High schools, we should ask the kids, you know, what ideas do you have for how we can sing together or how we can do theater together? I bet you they'll come up with some ideas that some of us old timers might not come across.
Now, there's a new question. They talk about sports that actually start in August, and that kind of pushes the decision point forward because August is not that far away.
Sure.
And is there any advice that you would have on somebody that's, you know, got a high school kid that's in a contact sport that's supposed to start in August?
Yeah. Well, I think it's okay to start playing and using precautions. And we know that being outdoors is safer than being indoors. And really, almost all the fall sports are outdoor sports. And so being outside, kicking a soccer ball, that's a fine thing to do. It's actually good for you to get exercise, be with other kids. Same thing with field hockey and some of the other sports. You know, we'll need to think about when there's close contact and some of the contact sports. You know, I know that that football is one of those slightly different kinds of sports, and you know, what are the precautions that we can take around that? So I know that's something that people are thinking about. You know, I'm really hopeful for as much activity and as much engagement as we can do, but we do have to be safe, and so we just don't have the answers for all of those things right now. We'll have to see how the epidemiology plays out. We'll have to see what good creative ideas we have.
So you've answered a lot of questions, Steve, and I'm sure there are many more from our audience. Again, please feel free to respond to the Facebook feed anytime in the future, and we'll try to answer your questions. This is an evolving story for almost every community and every single school district. People are trying to create an environment where the kids can be safe, but there are so many aspects of elementary education that is so important to early childhood development that continuing remote learning would have a significant impact on really the development of many of our children. So we have to figure out how to do this safe.
Yes.
Any final words or advice to the people in our audience?
Yeah, I think, you know, it's a call to come together as a community. And I would reach out to schools and school boards. You know, there's a lot of worry and there's a lot of fear, but you know, offering help, supporting schools as they go through this difficult process, supporting teachers. You know, my goodness, what we've asked them to do is really a lot. And I think as much as we can pull together, the better we'll go through this. So thank you so much for this opportunity.
Well, thank you, Steve, and thank you everybody for tuning in.